All right, good morning, everyone. My name is Dr. Charlene Ortiz, and today we're going to continue with our previous lecture. Now, regarding our previous lecture, we covered the basic schools of psychology. So we cover functional structuralism, functionalism, cognitive psychology, behavioral psychology, and lastly, we also covered humanistic psychology. So you may be wondering, what was the point in having all of these schools? Well, because we want to move from the theoretical side, we want to move to the practical side of things. So we actually start applying the knowledge that we had acquired through the schools of thought, right? So for example, structuralism, functionalism, and others. So now we're trying to move to the other aspect of things, right? So we're trying to move into practice. Now we did cover, to some extent, aspects of applied psychology. One of them was clinical psychology, which is what my doctorate is in. And we did talk about clinical psychology as that branch that is concerned with mental illness. So we are concerned in providing, illustrating, and coming to an understanding or an assessment of the symptoms. Therefore, once we have a good grasp of the symptoms, we can later move on into the diagnoses, not just simply to diagnose, but with the intent to provide a treatment plan so that we can either manage or reduce your symptoms. So that sounds an awful lot like the medical model, right? You show up to your medical doctor and you tell them about your symptoms, and later on, you are provided with a treatment with that diagnosis in mind. So are there any questions about clinical psychology as a field? Right, so this is the more traditional side of things that you generally associate psychology with. Now, something to keep in mind is that psychology, as you understand it, also covers a wide variety of professional specialties. One of them being school psychology. So in school psychology, we are worried in the aspect of understanding behavior in schools, the aptitude in schools. And we also know about industrial psychology. And in industrial psychology, we are interested in the behavior in the workplace, right? So for those of you who are in engineering, let's think about how your behavior is impacted and works within the workplace, right? How can we make this job more productive without you basically being consumed by your job, right? Because nobody wants to be a slave in their job. So part of industrial psychology is how much can we exploit the employee without the employee being exploited? Does that make sense? Basically, trying to trick the individual into working better, a better working environment. Now, in counseling psychology, when we're thinking about counseling psychology, this is what you typically associate with the more traditional talk therapy. Let's talk about the situation. In counseling psychology, we are focused more on the less severe, not necessarily the most severe, which is what you typically find in clinical psychology, although they could be exposed to that type of situation, a presenting issue with a patient or a client. So think about adjustment disorders, right? So a counselor would help you say, we're working with your adjustment to college, right? That would be something that a counselor would do. Adjusting to a divorce, adjusting to a breakup, adjusting to a marriage, right? So those types of things you can find within counseling psychology. Are there any questions about that? All right, fantastic, fantastic. Now, when it comes to cognition, right? Sometimes we hear that word and sometimes we don't understand exactly what it means. Every time you hear the word cognition, I want you to think about thinking. That's it. Think about aspects that involve thinking. So for example, all these processes like memory, recollection, so when we're thinking about that, we're thinking about things that cannot be observed, right? Hopefully, all of you are thinking, right? You don't have the intelligence of a carrot, right? So all of you are thinking, right now. I can't watch you think, right? I can watch you taking notes. I can watch you typing. Maybe you downloaded the slides previously, but I can't watch you think. So cognition is interested in the aspects that we cannot see as related to the mind. The argument is the individuals who are cognitive theorists, they argue that it's immensely important to study these processes because even though we can't see you thinking clearly, it has an impact on what you're doing right now, right? Hopefully the gears are running, right? Got a little oil in your lap, you know, the gears are turning for my engineers. Now, something to remind you of is that this perspective currently is the most observed one, if you will, right? So we moved from the functionalism side of things, the structuralism side of things, and currently we are using cognitive psychology as one of the predominant themes, one of the predominant factors currently in contemporary psychology. Any questions so far about cognitive psychology? Pretty straightforward, right? We're focused on the aspects that we cannot see, thinking processes. Now, the factor that I would like to point out is that cognitive psychologists argued that focusing solely on behavior, and if you recall from a previous lecture, behavior is anything I can see and record, right? So me waving my hand is a behavior. Me throwing a punch is a behavior. Right? So they argue that simply trying to understand the processes of mental health and behavior in general, just looking at behavior is not enough, right? Because if I throw a punch at someone, I've been told I have a good left hook. I don't know, I've been told that. I don't know if it's true. So if I throw a punch at someone, a cognitive psychologist would argue, well, there was an internal processes that went through her head before she actually threw that punch. So that's why just observing and recording that behavior, trying to explain that behavior, in their mind is simply not enough. As you can see, these are basically some of the schools of thought of psychology. You have your psychoanalytic school. So this is where Freud comes into place. If you remember, with the psychoanalytic, we had the perspective that we have underlying factors in your unconscious that guide you, right? And one of the examples that I provided last week was, you know, if you ask a guy or a girl out on a date, a person following the psychoanalytic school of thought would say, well, you're simply not asking out that person. There was an underlying factor that led you. So for example, your instinct of reproducing, right, about sexual behavior. So you didn't simply ask that person out. There was an instinct, there was an underlying factor that led you to ask that person out, even though you're not necessarily thinking about it. But notice that compared to all the other schools of thought, so we have psychoanalytic, neuroscience, and behavioral, cognitive psychology seems to have the vast interest or grab the interest of the mainstream persons that practice psychology. Now, something immensely important is that in psychology, as with many other fields, historically, we made the mistake that we didn't include the rest of the population, right? We were focused on a very mainstream, what we consider the more stereotypical academics, for example, a white straight male, upper class male. And we noticed that what applied to that person doesn't necessarily apply to the rest of the population, right? So let's think about this. I am biracial, I'm a millennial, I was wounded in war. So my perspective, right, it's going to be very different from, let's say, a middle-aged, lower-class Chinese immigrant. And the mistake that we were making in psychology was that we were only focusing, especially early on that stereotypical view that we had about science, right? This only pertains to the average upper class white male. And we could actually, if we think about it, we can actually take like a small census here and say, which person here does that apply, right? Probably maybe one or two of you guys. So that means that the science that I'm investigating is not generalized to the rest of you. So how good is that? Especially if we're trying to apply the knowledge that we have. And because of that mistake, we started to broaden our horizons. Now, one of the issues that we have come across with broadening our horizons is that we started understanding that the treatment methods that we were utilizing perhaps did not apply to the average person. So imagine if I have a treatment plan where this person, I recommend that they start exercising or they do certain things, but this person doesn't even have anything to eat because they're homeless, right? So we need to start incorporating our treatment towards other people, right, as it applies to that person. Interestingly, there were two reasons as to why we started noticing that we're making a mistake. One of them is because we started having advances in communication, right? Because of the internet, because of instant communication, right? So chatting, email. Because of that, we started noticing that there is in fact a wide world out there. The world basically began to get smaller and smaller because of communication, right? They didn't have to be like the pioneers, like you wanted to send a text to your girlfriend in California, you're over there in New York, and this guy has to get on a horse and it takes him like 3 months. That's in Tennessee. Right? I guess we forgot. did change how we catalog. What when I go to that's I am seeing demons, right? More symptomatic, right? Because within the context, it doesn't sound like it's something that would be environment. So say that your peers were talking about with parenting. So generally, when we think about psychology, we're thinking about the negative aspects of things, right? We're thinking about the symptoms, the pathology, the diagnoses, the treatment, but we actually started moving a little bit further away from that direction. And this is where positive psychology comes into play. Now, in this regard, what we are worried about is that approach, both in practice and research, that help us understand the positive aspects that will allow you to fulfill your human existence, right? So for example, what your peer here was mentioning, someone who's schizophrenic may miss work, right? So we're looking at the symptom as it relates to that person's well-being. But in positive psychology, on the other hand, we are looking into what positive aspects with this person that this person has schizophrenia that would help him improve his existence. For example, this person who has schizophrenia has active hallucinations, seeing demons and angels. He's not showing up to work, but maybe this person is the best engineer that ever engineered in the history of engineering, right? So in positive psychology, we start exploiting those positive aspects of the person instead of trying to exploit and manage the symptoms, right? So they are trying to move towards that direction, moving a little bit further away from the diagnostic side of things. Now, there are multiple areas of interest, and we want to cover 3 of them briefly. So we want to look at that person's either positive, subjective experiences. Why is it subjective? What makes it subjective? I mean, it's positive, right? So everybody should think it's positive. For some of you, getting a C in this class would be a bummer, right? Whereas for the person right next to you, man, I got a C, I'll take it, right? So notice that positive experiences are subjective, right? But you may think, man, this sucks, I didn't get an A. For someone getting a C, it's best case scenario, they're like, yeah, I got it, that's the class. Woo, never gonna see Dr. Shar again, right? So notice that it involves understanding that subjective experience that we deem as positive. Now, we are also looking into positive individual traits. You can also think about that as personal virtues, if you will. So as the example that our friend here was mentioning, a person who's highly schizophrenic, they're actively hallucinating, they're missing work, but it turns out they're the team lead in their engineering project, they're immensely smart, and they do really well. So we will try to exploit that trait, that this person not only has a positive experience because they like their job, they also have an individual trait, right? They're immensely smart in the field of engineering. So in positive psychology, if this person were to show up in therapy, we would try to exploit that. We would try to say, you're the best team leader. I mean, you send rockets to wherever, right? We would try to exploit that individual trait that was positive. Now, in the sociology sense, like your friend was mentioning, we also want to exploit the positive institutions and communities, right? Perhaps this person has good institutions, so let's think about perhaps churches or temples or synagogues that that person can attend to. He has community services. He has an anime club that he can go to, right? So positive institutions. Where my anime freaks at? Hey, I see you. So notice that there could be positive institutions or communities, right? Providers, university. There could be positive aspects that this person, these resources that this person has in order to promote a better human existence. Our idea in the past, unfortunately, was you have this issue, you're going to be sent to a hospital, you're going to be there the rest of your life. So we started moving from that perspective, 17, 18, 1900s, and now 21st century, we started moving towards the more positive psychology side of things. Any questions about that? Yes, ma'am.
There's such a thing as, I guess, positive hallucinations, basically where someone hallucinates, but their hallucinations help them through life, like keep them on track.
You said positive hallucinations?
Yeah.
So when we say positive hallucinations in mental health, we mean things that make you do, whereas negative hallucinations are things that make you stop doing something. So, but you mean something happy?
Yeah,
right?
like basically hallucinations encourage you to go to work or encourage you to do good things.
It's funny you say that because there are some cultures that hallucinations are actually really positive, right? So if you find a schizophrenic person in another culture that would say, you're the best, you are so good, you're the best. Whereas here in America, you're the average American person, your hallucinations tend to be really violent and tend to be really awful, right? So that's what you're talking about. It will differ based on culture, right? So that's another thing why in regards to, we'll go back a little further. That's why cultural diversity was so important, because mental illness doesn't look the same from one culture to the next. Yes, sir. I'm sorry? Yes. Because chances are I'm not the greatest person in the planet. So if I have these hallucinations, this is going to guide my behavior. So if I think I'm the best professor, but I'm really pulling my hair during class, am I really the best in the planet? Chances are yes. That is, however, defined by the person, because if the person doesn't think they have a problem, there's nothing to treat. Just like psychopathy. Psychopaths don't think they have a problem. That's why it's so hard to treat. Any more questions? Yes.
What's the best way to live with someone who has schizophrenia?
That would be a question outside of the scope of this class, but I will tell you, that's not to dismiss you, of course. I will tell you that in order to treat schizophrenia, generally you have intensive psychotropic treatment and therapy. So generally you have both, because that would improve the quality of life for this person, hopefully in their family. So I will say that. Anybody else? Yes, sir.
So you're saying that certain mental illnesses differ with different community, or cultures. Are there some that are pretty similar across the board, like sociopath, stuff like this?
So think about, for For those of you who are in business, right? Anybody here in business or business minor? Okay, so let's put it in the business culture, right? If I am a go-getter and I want to step that ladder and I am the best marketer, I am the best networking person, and I gotta do what I gotta do to succeed. For a business person here, that sounds great, right? That also sounds great for a psychopathic person, right? Because they will do anything they can to benefit themselves, right? So in a social type of sense, maybe that's not a good advantage, because if I have to climb over other people to succeed, how good am I gonna do in the workforce? I'm gonna be that guy everybody hates, or that girl everybody hates, right? But in a business sense, man, this guy is getting it. He got promoted within like 6 months, right? So in the business culture, that type of expression would be normal, if you will, if not sought after. Whereas, say, in your anime club, and this guy, well, I got all the anime that's ever animated ever. I mean, you really want to hang out with that guy, right? So think about that. That's why culture informs how we express and we understand it. Any more questions? Fantastic. I'm going on mute, my beautiful people. Sorry you can hear my beautiful voice. Let's see. Now we have covered, that's really loud. So we have covered initially the definition of psychology, right? And something that I mentioned in our previous lecture is that we utilize science and we utilize the scientific method in order to understand behavior. Because of that, psychology is the science that studies behavior and the physiological cognitive processes that underlie behavior. Now, psychology as a field does not necessarily stay within the theoretical frame, although we always need that theoretical frame in order to inform research and therefore conduct applied things, for example, how we conduct therapy. But I do need you to remember that the point of psychology is to apply what is known, right? For example, the point of engineering is understanding math so it can be applied, right? It's the same case with psychology. We are applying knowledge so that it could be applied. So for an engineer, math is no good unless it serves an applied purpose, right? Basically, some of that also pertains to psychology. Now, in regards, hey, we're back alive and in color. Now, in regards to psychology, psychology is immensely active. Psychology, we always need more therapists, we always need more counselors, we always need more researchers. So if you have a gift for math and research, we need you, right? Because generally everybody wants to work in the field of applied things, but nobody wants to work in the theoretical side of things. So I actually teach research here. I also teach that class. It is thriving, it's always necessary. And with younger generations, with millennials and Gen Z, is actually mental health has become more, let's say, less of a taboo. So now people understand the value of therapy compared with our parents and our grandparents. So because of that, that's another reason why psychologists feel is so thriving. Yes, sir.
Yeah, the only issue with that, I would say, is that nowadays there are some people who are now think that mental illnesses are almost good. Like you see, it's not necessarily because it's always the bad apples in the social media and stuff like this. You see more and more that people claim to have self-diagnosed, claim to have anxiety or stuff like that.
So something about that. So your friend was mentioning, your colleague was mentioning that he considers that the downside about it being so open and thriving is that perhaps psychological illnesses may be viewed in a positive side of this mental illness. I will say that psychology is what we know as a popular science, which means that it's applied for the populace, it's applied for the people. So because of that, a lot of people think they understand mental illness when they're not trained, or perhaps they are misinformed with stuff they read on Reddit or stuff like that. So then you start informing your decisions, like, I saw this guy on TikTok that said that this symptom, oh, maybe I'm bipolar. Well, that same symptom, even if the person's right, that same symptom can apply to so many different mental illnesses that are you really bipolar? Probably not. Maybe you are. But the point about that is it the information that you're getting, is it truly accurate, right? So I see where you're coming from. All right. Any more questions or comments, concerns? Fantastic. All right. Now, where do psychologists work? Where do people with doctorates work, right? So many individuals work in the area of private practice, right? And what does that mean? People who work under supervision, like myself, people who see their clients, and it is a private business, right? This is an institution that is privately owned, whether it be a clinic, a hospital, an office. Many persons work in colleges or universities. So people like me, yours truly, go Chargers, right? So people who work in that setting, right? People who work in the college setting. Generally, it's either teaching or doing research, right? So that's why you would hear often research in so-and-so university show. That's why, because you have an immense group of people that work with the universities. And as you can see, one of the larger ones is also hospitals or clinics. Generally, you're thinking more about the clinical aspect of things, more of that medical model, things you would see in the nursing field, right? So that's one of the next aspects. So any questions about that?
You said this was for the breakdown of the people with doctorates in psychology?
Generally, this is what it looks like for people who have doctorates in psychology. All right. Now, there are many areas of interest, and we will discuss some of them today. So what areas of interest are we working on when it comes to psychology today? Well, the first one I would like to talk about is developmental psychology. As you can see, it's a big percentage, about 18% of persons work in this field. What is developmental psychology? Right? Developmental psychology is looking at life throughout its development. We're looking at that lifespan since conception until you die, right? And generally we think about developmental psychology, a lot of people think about kids, right? Because we start thinking, well, you know, that's when people develop, right? When you're a little kid and you go into adolescence and boom, you're an adult. That's not true, right? You're growing, you are changing, you are adapting, you are adjusting your entire life, right? So that's why developmental psychology is worried about basically conception all the way up to the day that you die, right? So it's not just children. A lot of people study developmental psychology thinking, you want to work with kids, which, to be fair, is a big portion of what we do in research and practice when it comes to developmental psychology, but it can also work with the elderly, right? Because they are also changing and adjusting, right? From now I'm retired, now I'm changing careers, now I'm retired, my kids are grown up, now I'm having grandchildren, great-grandchildren. So notice how there's still a development in this person, right? So I don't want you to think, oh, it's just with the children, right? Absolutely not. It also involves the other aspects. Now, the next area that I want to cover is social psychology. This is where you start thinking about how your roles, your interpersonal behavior plays a role in the social factors governing behavior. What do I mean by that? Well, let's think about generally when people teach, right? They sit down. This I call the queen's chair because nobody has it. This is my reasonable accommodation and I love it. And usually when people teach, they sit up in front of a crowd. So that's a behavior that is governed by social rules in this society. But what would happen if I taught class and I sit down on the floor? You know, that'd be pretty bizarre, wouldn't it? It would be pretty bizarre because as we understand things, we have social parameters that inform, right, how we teach. So that behavior, we use our social norms to inform our behavior. So that's what social psychology is. Say, for example, altruism, right? The ability of you to help other people. That's something social psychology would be interested in, because there's social aspects, social rules in society will inform our behaviors. Just like I know that in this society, either we stand up or sit up to teach, not sit on the floor. What if I laid on my side? Draw me like one of your French women. I don't know if that reference lands on anybody. All right, good deal. So we don't want that, right? Because we know that that wouldn't make sense if I just lay on my side and teach. But why is that? Because we know that socially we have an aspect that informs that behavior. Yes, sir.
You should teach one day. You'll do it.
I'm doing that. I don't know. I'm getting too old. I got a little wobble too every now and then. Any more questions? Now, let's move towards educational psychology. And what is educational psychology? Educational psychology focuses on the best ways to teach. What are the best ways to teach someone? What is the best way to help a person learn? So for those of you who are in education, for those of you who are thinking about a career in education, we're thinking about learning styles, teaching styles. So educational psychology focuses on what are the best ways to learn. Let's talk about health psychology. So in health psychology, we are talking and we're interested in what are the psychological factors that help us with the promotion of good health, that help us with the prevention of an illness, that help us with the treatment of illness. And when I mean illness, I mean physical health, right? I mean physiological health. So a question a health psychologist would ask themselves, right, in thinking about causes, prevention, and treatment, they would say we have an increase of cases of chlamydia on campus, right? So we start getting more cases of chlamydia. A health psychologist would be interested in what behaviors led to that increase in cases of chlamydia. And once we do that, how can we find prevention methods, right? So for example, utilizing barriers, condoms, things of that nature. What is leading to either a reduction or an increase of that? So health psychologists would be interested in how we prevent and the behaviors that we can use to either determine cause, prevention, or treatment, right? And once you have chlamydia, then a person in health psychology would say, okay, what behaviors could promote treatment with this person? And so that's another aspect that health psychologists will be focusing. Any questions about health psychology? Right, so generally it's interested in the physical illness. Now, physiological psychology, when we are worried in physiological psychology, we're thinking about the influence of genes, right? What genes promote which behavior, right? Which genes are passed on that we can see manifested in a group of people, in the individual. And experimental psychology, who here is in psychology or psychology minor? All right, you're going to take experimental psychology, maybe with me, who knows? It's awful, it's a very difficult class, but you know what? You can do it, especially if you do it with me, right? What is experimental psychology? Experimental psychology is worried about the sensation, the perception, the learning condition, the motivation, and how can this be empirically tested? So this is where you start getting all your statistics and research and true experiments and quasi-experiments and correlations. Cognitive psychology, as you know, deals with the internal mental processes, right? With things we cannot see, like memory and thinking. And psychometrics, maybe some of you have been involved in psychometrics and don't even know it, because this is where we focus on the measurement of a behavior or an underlying factor. So for example, if you've taken an IQ test, that is psychometric, right? If you're taking a test to determine how much anxiety you have, that's psychometric. Taking an assessment to determine your levels of anxiety, levels of stress, that's psychometric. That's actually a standardized tool that involved a lot of research before you in order for this tool to be reliable. So a lot of psychometrics were involved in this process. And lastly, personality psychology. What it's interested in is in the consistency of your behavior, right? Personality is traits that we use to inform our decisions, right? So if I have an extroverted personality, I'm going to utilize this trait to inform my behavior, i.e., if I'm extroverted, that's my personality, so I'm going to go to that party. I'm going to talk to that lady. I'm going to go talk to that guy. Ooh, that guy seems cool. Let me talk to him, right? Our teaching method, right? So personality informs our behavior, right? Because it is long-term, right? It's a characteristic that we hold for a long time. So because of that, we do use it to inform our decision. So any questions about personality psychology? Good deal. Now you may be wondering, what's the difference between all these fields? Because you have psychiatry, counseling psychology, industrial psychology, school psychology, clinical, I mean, we have all sorts of things. That is because in each field is interested in different things. Let's talk about psychiatry. What's psychiatry, right? Psychiatry is medicine. It's a form of a medical field, right? Just like your dentist, just like veterinarians, it's a form, gynecologists, everybody. Those are medical doctors, right? Psychiatry is a field of medicine, right? So because of that reason, generally, you'll find that psychiatrists have an MD, medicine doctorate, right? A doctorate in medicine. They're not psychologists, they're psychiatrists, which means they utilize a medical model to inform their diagnoses and treatment. Their interest is to treat psychological disorders, psychological problems. So a psychiatrist, those of you who have one, the psychiatrist will make a list of your symptoms, and based on the DSM, the Diagnostic Statistical Manual of Mental Disorders, he will make a determination of which category of mental illness does your symptoms fit in, and then he will provide you with medication in order to reduce or eliminate your symptoms, right? So this is a field of medicine. Notice that I didn't say therapy, right? I didn't say he's going to sit down and talk to you, right? I didn't say that. I said he's going to take a list and assess your current symptoms, just like you would if you have a fever, you're coughing, I should say, you're vomiting, and you go to the doctor. That is exactly what a psychiatrist would do, but with symptoms related to mental illness. Any questions about a psychiatrist? What is psychiatry? Good deal. A lot of people get that confused. Now, as I mentioned earlier, clinical psychology is non-medical. A psychologist, a clinical psychologist does not hold a medical doctorate. They generally hold a Ph.D., a Ph.D., or an ED, but generally it's a Ph.D. Those are the three most common types of doctorates in psychology: Ph.D., Ph.D., and ED. And similar, they are similar to the psychiatrist in the sense that they are interested in your symptoms, assess your symptoms in order to provide a diagnosis and address that problem with mental illness, and they also provide treatment. The difference between the two, however, is that in psychiatry, the treatment involves medication. For the clinical psychologist, on the other hand, the treatment involves what we like to call talk therapy. That is not to say that a psychologist couldn't potentially prescribe, but in order to do that, they would need to go to school again. Yeah, post-doctor. It's immensely rare, very, very, very rare. It's actually immensely uncommon. So for that reason, clinical psychology is focused on the assessment of symptoms, understand that problem, that psychological problem, towards treatment with talk therapy, which you normally associate with therapy. This is not to say that one's better than the other. They simply have different treatment purposes. So a lot of people would say, which one should I see? You're having to ask that question, it's probably both. Right? Why do I say that? Because the way I like to see it, let's think about you have an awful fever right now, and you're boiling hot. And you go to the ER, right? You're boiling. The ER is going to take care of that symptom, right? Right then and there, which is the fever. It's going to reduce that symptom. Whereas the medical doctor, once they see you, they'll assess you, determine you have an infection, here's some antibiotics, right? I like to think about that. The fever would be treated by a psychiatrist, and the long-term infection will be treated by a clinical psychologist. So notice that the psychiatrist tends to deal with the symptomatic expression that is causing immediate acute harm. And then the clinical psychologist, okay, we have this under control. Let's deal with the long-term things. So for example, I like to equate that to the long-term, for example, trauma, right? So you have depression, you have active expression, an acute expression of that depression. So maybe a psychiatrist can prescribe medication for that, but that's not going to deal with the long-term aspect, right? So perhaps with the long-term chronic aspect, you want to talk to a clinical psychologist, right? So that's the main difference. One's not better than the other. They simply treat different things. Any questions about that? Fantastic. But generally, people tend to confuse the two. I see that all the time. I don't see it at least once a week. That was a weird week. I didn't see it. All right.